Today we join the rest of the world in commemorating World AIDS Day by remembering those we've lost, gauging our challenges, celebrating our strides, and empowering those who are still fighting. This pandemic has been around for decades, and at one point in time we knew very little about how to prevent HIV/AIDS or how to treat it. What we did know was the devastation that it inflicted. We've seen death tolls, the displacement of families, and the pain suffered by HIV/AIDS positive victims who were stigmatized, discriminated against, and ultimately excluded from accessing the support, care, and treatment services they so desperately need. Over the past 5 years, the decline in HIV infection in adults has stalled, renewing the call to action to address the root causes and reinvigorate efforts if we are to end the AIDS epidemic by 2030. We have witnessed the negatives, but we have also seen the positives in the work of the multi-sectoral approach that the National AIDS Commission, its local, regional, and international partners have put into preventing and addressing the pandemic through prevention, care, treatment, and support services. The epidemic is now concentrated in the community of men who have sex with men. We cannot back away from it. We have to deal with it. We have to foster an environment that lowers stigma and discrimination. We also need to get sexual and reproductive health education on board for young people. It is their human right. Worldwide, we have seen an increase in biomedical and scientific advances that can allow HIV/AIDS positive persons to live long, productive lives. This includes the antiretroviral treatment that can effectively prevent the HIV infection and decrease the risk of HIV transmission, as well as treatments that are bringing us closer to eliminating HIV from an infected person's body. In Belize, the national response to HIV, which is coordinated by the National AIDS Commission, has made significant strides in guaranteeing that every person has access to life-extending information so that they can access treatment, care, and support services, regardless of age, gender, race, ethnicity, sexual orientation, gender identity, or socioeconomic status. Free HIV/AIDS testing and public health data has allowed us to focus our attention on districts that have the highest burden of HIV incidences, and national awareness efforts have taken off. Still, more work remains to be done, and more investments are needed from the different sectors of society in order to embark on a fast-track strategy to end the AIDS epidemic. The National AIDS Commission has embarked on a campaign of creating awareness in an effort to have a concerted approach to removing the barriers that inhibit the access to health care services by the most vulnerable and at-risk individuals in our community, with the overall goal of working towards an inclusive society, one of zero new infections, zero discrimination, and zero AIDS-related deaths. The government of Belize has committed to additional investments in HIV/AIDS as a testimony to their seriousness in putting an end to the HIV/AIDS epidemic through a fast-track strategy developed by UNAIDS. Significant accomplishments have been achieved in the area of elimination of mother-to-child transmission due to a strong program by the Ministry of Health, where all pregnant women are tested for HIV and placed on treatment if necessary. I sound the call for more meaningful engagement from people living with HIV, other key population, and broader civil society in strengthening community voices to improve policy development, strategic planning, monitoring and evaluation, resource allocation, service delivery, human rights protection, and capacity building. I remain convinced that together we can make a difference in strengthening the HIV prevention efforts so that we may reach a day when all people living with HIV get tested, are retained in care through antiretroviral therapy, and have a viral load suppression. A day when there are no babies being born with HIV, and a day when we achieve our ultimate goal of having an AIDS-free generation.